Good afternoon, all. So my topic is about nerve tracking in different lenticular procedures. So lenticular extraction procedures, as we all know, are known to cause lesser dry eye, the lesser biomechanical changes, and faster corneal nerve regeneration when compared to the LASIK procedure. So these are few studies which show that the percentage changes over time in the nerve fiber density between SMILE and femto-LASIK. It showed better corneal nerve regeneration with the LASIK. So the question is, how does it translate to our post-operative outcome? So these are the serial scans of confocal microscopy from preoperative period to 1, 3, and 6 months post-operative period, which shows that there is slower regeneration in the LASIK group. So this translates to a poor ocular surface, which is indicated by the poor non-invasive breakup time. So as we all know now, there are various Calyx platforms that are available currently. So these are the three platforms available: Zeiss Vizumax, J&J Elita, and Schwinn Datos. I have no financial disclosure here. So these are three different machines, variable laser energy settings. They have unique lenticular profiles. So let's see how they differ. There are variable energy laser energy settings. So energy per pulse when compared to SMILE, which was 110 to 150 nanojoules, it is 40 to 70 nanojoules in Elita and 75 to 135 nanojoules in ATOS. Further, if you see in ASOCT, we found out that in SMILE we had plano-convex profile when compared to Silk and SmartSight, that is ATOS, wherein we found that the lenticular profile was biconvex. So we did a 3D reconstruction of the lenticular profile using the ASOCT maps, and these are the 3D profiles that we see. Same, the plano-convex versus the biconvex profile. That brings to our research question. So how do these varied lenticular profiles impact the corneal nerve regeneration? So we did a prospective comparative clinical study wherein we quantified the corneal nerve regeneration in terms of corneal nerve fiber length and density with all the three different lenticular platforms. So we had 20 eyes in each group. The age and refractive error was matched. All the patients underwent basic clinical evaluation, routine imaging, which includes Pentacam MS39 Corvus, and serial scans in confocal microscopy, followed by lenticular-based refractive surgery in all the three platforms, in each group containing almost 30 patients. So we evaluated corneal nerve fibers. As you can see, the red color fibers are the principal nerve fibers and the blue ones are the secondary nerve fibers. We mainly checked for the length and the density of the fibers. So these are the serial scans of confocal microscopy, which shows that in the biconvex profile lenticule, there was good corneal nerve regeneration when compared to the SMILE group. So this is the statistical analysis showing superior regeneration of corneal nerves in terms of density and length with biconvex lenticules as compared to the plano-convex technology, which again translates to a healthier ocular surface and also tear film integrity. So how does the lenticular shape affect nerve regeneration? As you can see here, if the plano-convex in the plano-convex lenticule, there is a side cut, which will cut more nerves when compared to the biconvex profile. So this is a short animation which shows the difference between the two procedures. So the biconvex, because of the lesser side cut, it will preserve the nerve trunk. So not more of the nerves are cut, which will translate to a healthier surface in terms of regular epithelium. And also we can see a faster corneal nerve regeneration. To conclude, our results also showed that the change in corneal nerve fiber density was significantly lesser in the biconvex group when compared to the plano-convex group at 1, 3, and 6 months post-operatively. And similar changes were seen in terms of length of the corneal nerve fiber as well. To conclude, we knew that the lenticular extraction procedures have lesser chances of dry eye, better corneal regeneration, lesser biomechanical changes. But what the study adds is basically the biconvex shape lenticular profile and lesser cumulative energy in Silk, and the tissue saving through optimized lenticular geometry in SmartSight, that is ATOS, will lead to faster and more superior corneal nerve regeneration when compared to the plano-convex. So to conclude, we found that there is superior corneal nerve regeneration in the newer laser platforms when compared to the traditional ones. Thank you.
Did you also check for the corneal sensations?
Corneal sensations clinically, yes, ma'am. But it usually in the immediate post-operative period, both had similar you know,
So how
results.
did you check the corneal sensation?
Usual way with the cotton bud.
Doesn't
Yeah,
really
but we cannot
quantify.
quantify it. So that is why we used confocal microscopy to study the nerves.
But does the structural thing translate to functional effect?
So that is why we studied the tear film matrix, ma'am. That is why, so it is indicated by the non-invasive breakup time. We clearly saw that there was a difference between the, you know, group 1 and group 2, that is the biconvex and the plano-convex.